As operating stopped over COVID, we had this huge backlog of patients that we needed to get through. And so the idea was, how could we get as many of these operations done in as short of time as possible to make a dent into the waiting list?
So today we're going to be running one of our rapid lists we've been running for the last year or so. We're going to be dealing with some common ENT problems, tonsillectomy, adenoidectomy and grommets, and we're grouping them together so we do the same procedure and we get through the patients quickly but safely and get everyone treated as best as possible.
We aim to do 20 patients over the course of the day, which is quite a big increase to the normal numbers. We aim to do about between 10 and 12 patients in the morning. They're all having their tonsils and their adenoids removed. They arrive in the first cohort at about 7:30, and then the second cohort arrive at about 12:30. They're usually about 8 patients, and they're having a mixture of operations, usually an adenoidectomy and insertion of grommets. We try to get as much done as we can do before the actual operating list. So for example, I will look through all the patient weights and do all their prescribing for the take-home pain meds. I pre-populate all of the operating notes. This is really about creating time for me so that I'm not doing things when I should be ready to operate on the next patient. So each of these things in terms of pre-op preparation saves us time on the day to increase our efficiency.
So we arrived at about 8 o'clock in the morning and we went up to the ward. We were greeted by some nurses that showed us to one of the cubicles and asked Lily to sit on the bed. Next, one of the nurses came and did Lily's height and weight.
I like to get down to the patient's level and so I'm not towering over them, and often build quite a good rapport just by being a bit silly, talking about their cartoon characters, that sort of thing. And generally that works well for us in this trust.
And then the porter came in, he was lovely, bless him, chatted to her, made her feel at ease and brought her down to the room. We said goodbye to her dad at the entrance to the theatres.
So we have extra members of staff, so there'll be 2 scrub, 2 support workers, 2 ODPs, and we all have his own designated roles, which is pre-planned before we actually start.
As a patient comes into the operating theatre, there are lots of specific things that have to happen. So somebody has to bring a pedal to my foot so that I can operate, for example. Somebody has to put a Draffin rod bar under the patient's head so that the Draffin rods which hold the Boyle-Davis gag in place can work. And each person has very, very specific tasks that they do, a bit like in a Formula One team at a pit stop. Each person has a very designated task and they know that their job is to get that job done as quickly as possible. And it's this thing that really drives the list forward, eliminating delays as much as possible.
When the patient's finished, we take them to recovery, hand the patient over, and then as soon as I've returned to the anaesthetic room, the next patient is there waiting to be checked in, possibly waiting to be cannulated, and then we repeat the cycle.
So the next thing the patient will encounter is they'll be waking up in the recovery room, there'll be a nurse with them who's helping guide them through that whole process. And then once they're awake and safe to leave the recovery area, they're taken back to the ward, reunited with their parents. They're then observed for between 2 and 3 hours, and as long as they're eating, drinking, their pain is under control and they're sent home.
It's had a really big impact on Lily because before she was waking up quite a lot in the night, every night. So she had quite poor quality sleep, and ever since she's had the operation, obviously she had the recovery period, but after that, within 2 weeks, she slept through every single night without fail. So it's been amazing.
She's already told me she can breathe much better when she's at school, when she's doing things like PE and sports, she's not having any problems. Things like when she goes to sleep, she was taking over an hour and a half to get to sleep. And she's nodding off a lot quicker now, and generally for everyone it's miles better, and I'm glad it's been done. I really am glad it's been done.